problematic outdoor air gets into people's apartments, even when the clean air centers, getting air purifiers out to them would have been a rapid, effective response to better keep New Yorkers safe.
We disagree. We think it would actually be putting New Yorkers in danger by having them go outside of their homes into
wearing an N95 mask, walking a couple blocks, or getting on a subway stop, or taking a bus a couple blocks to get to a safe place to go when they are currently in unsafe conditions. That seems odd.
I would not want to put people into unsafe conditions outside. Is the point?
A brief period of time outside when they're in unsafe conditions in their current
and the
setting.
doctors and the medical experts on this. But
It's not what other cities do around the country in similar circumstances. I'm surprised that when we've seen wildfires across California, they set up clean air centers for people to go. This was a safe mechanism that was done repeatedly. We don't have that. We didn't do that here. Secondly, it's the failure to call a code red. We have, according to the Hope survey that was, the Hope count that was completed last week, significant increases in the number of street homeless individuals. Those people have no place to go. They were breathing in the toxic air minute after minute, hour after hour, getting sick. These are people who have chronic health conditions, as Deputy Commissioner Schiff knows well. And yet we did nothing for them. There was some additional outreach, but there was no code red issued, so they could not enter any homeless shelter in the city of New York to get the assistance they needed because we failed to act. Why was a code red not called?
So a code red, so first off, I agree. The most important thing during an event like this is taking care of our city's most vulnerable, and we did that. Especially,
I disagree.
You're happy to have you disagree, but we had Department of Social Service outreach teams, as they would during a code red, going out, encouraging homeless New Yorkers to get off the streets into shelters, providing masks. The difference is that a code red, like a code blue, are used for different types of emergencies. A code red is specifically for heat-related emergencies. Yes. They're doing things like getting them into a cooling bus. They're doing things like handing out sunscreen. They're doing things like looking for signs of hydration.
Of course, there are particular elements to a code red.
The protocol is very different from a code red. Or we also didn't execute a code blue, which is what we would do during a winter emergency. Sure. Because the risks to homeless individuals were not cold weather, just as it was not heat. It was air pollution.
The risk was being outside.
And so our DSS teams, yes, and that's why we had DSS teams doing additional outreach, going to places with poor air, distributing masks,
the most important element of a code red or a code blue policy is that any street homeless New Yorker can walk into any shelter in the city of New York and immediately get shelter. They can get a bed in any place, anywhere they go, in the many hundreds of facilities around the city. Why did we not implement that policy during this toxic air emergency?
That was implemented, just not as a code red or a code blue, because a code red or code blue, there are very specific protocols for heat and for winter weather. At the June 7th press conference that you held with the mayor after this onset of the emergency had occurred, the issue of homelessness and homeless New Yorkers was not mentioned once. Never during this time period was it ever said that in the additional outreach that was being done to street homeless New Yorkers, that they could be told they could enter any homeless shelter in the city of New York. That has never been communicated. The additional outreach was being done. We were handing out masks. We were encouraging them to go into shelter.
Encouraging people
but we were not doing the same thing we would do during
somebody who's homeless on the streets in the Bronx is told, hey, you can go to 30th Street to enter into a shelter system. We failed street homeless New Yorkers in this incident, and I hope moving forward we develop the right and necessary protocols so that we can ensure they can access shelter in their immediate vicinity to get to safety. Thank you.
I 100% agree with the value of your question, but I think we need to just accept that a code red or a code blue are different protocols for different types of emergencies.
I think I made clear the crux of what was needed was to ensure that people could enter shelter.
With all due respect, that was done.
It has never been communicated to this date. It was not communicated during the emergency. In the response from the mayor's office at the time, there was no mention of homelessness in the press conference, the first press conference that you held. This was not prioritized. These folks were ignored, and I'm deeply disappointed.
We did additional outreach 24/7.
All right.
But thank you for your question.
Councilmember, do you have more questions? I don't want to cut you off. Do you have something else?
That's fine. I'm fine.
Okay. Councilmember Hanif.
Thank you. Good to see you again, Commissioner Iscall. I'll dive right in. What guidance was specifically offered to families and residents at the HERCs, the respite centers, the emergency shelters, and the shelter system more broadly?
So I can't speak to the shelter system. I would have to refer you to DSS and DHS. In terms of the respite centers that we're running, it was the same guidance that we were providing to all New Yorkers. We made sure that we did that through language access, and we also made masks available.
Could you share what through language access was available?
I'm happy to.
Flyers, pamphlets?
I'm happy to get that information for you. Yeah.
You can't share anything
I
on
don't
the
recall
record
it
about,
off the
because
top
I
of my
know
head,
that
sorry.
the council had reached out to you shortly after our clouds were, the sky was orange and fire, to understand how asylum seekers were receiving this information, and it seemed that your response was unclear. It was not a response. You sort of ignored the question. So I'd like to know what, after this, we would be receiving if.
100%. I will talk to my team and make sure we get that information for you.
And I'm also just curious, I know you mentioned and emphasized the interagency conversations. Why are you unable to talk about what the plan entailed for DHS, DSS?
Because they have their protocols, and I would defer to them to talk about what was actually done in the shelters at the tactical level.
So just to be clear, right now you're unable to share exactly what the outreach.
You asked me for
mechanism was.
specifically the information that DSS provided at each of the shelters. I know that additional information was provided. Exactly what it is, I don't have in front of me, and I want to make sure you're getting the most factual and accurate information.
I appreciate receiving the factual information, but it is disheartening to know that you can't share what kind of information was shared or what the outreach entailed.
Again, I'm happy to make sure that you ask DSS and DHS to provide that information of how they did it.
And then on unhoused New Yorkers, could you walk us through what the outreach was?
So it was 24/7. It was additional outreach. I could get the cadence and the time. I don't have those exact metrics in front of me about the amount. Generally, what they do during a code red or a code blue is, in addition to the weather-specific information that's provided, things like a warming bus or things like sunscreen, they also go to different locations, right? There are locations that more of a concern during heat versus more of a concern during cold weather. But I could get, circle back with information on the cadence and the time and the locations of where they were doing that outreach. I don't have that in front of me.
That would be helpful, and also just what the cadence will look like in future incidences to ensure that unhoused New Yorkers are being escorted and not being told to jump in the
100%. And this is a priority of ours, and it's why we did 24/7 outreach. It's why we did mass distribution. It's why we did the enhanced outreach teams during this event, because we care about this.
Great. And now I want to focus on worker safety, and Chair Brewer had raised this question earlier. In these interagency calls, protecting municipal workers come up? And I know you mentioned that OLR provided guidance, agencies have different missions. What was the overall protocol that the city sent out for municipal workers and their ability to work from home?
Yeah, and I'm glad you asked this question, because I wanted to circle back to Chair Brewer's question and just sort of, we did specific calls with the experts, with the medical experts, and with OLR, and with commissioners and the agencies, specifically around making sure that we were caring for the health of the city workforce. That guidance was provided to OLR. OLR provided their guidance to different agencies. But I just wanted to reiterate that the health of our workforce is of paramount importance, and that's one of the reasons that we had those conversations. And in terms of some of the guidance that Department of Health provided during those conversations, do you want to talk about some of it?
Sure. The guidance for workers, including for city workers, parallels the guidance for individuals. So when the air quality is very, very poor, the recommendation is to limit time outside and to limit strenuous activity outside. So for office workers, they're already indoors, so that's not a major concern. For city workforce that works outside, especially for our essential workers, there are ways to mitigate some of those risks. So to encourage breaks, to provide workers with high quality masks. And those are the kinds of recommendations that we provide to our sister agencies, which then have the responsibility to take that guidance and figure out how it applies to their workers, considering the kinds of work that they do.
Chair Brewer, I have a few more questions that I want to wrap up on this topic. Did the city implement work from home protocols for appropriate municipal workers? Was there a memo sent out to the?
It was, I would again defer to OLR, but it was at the commissioner's discretion based on agency requirements, personnel needs, but we're happy to have asked OLR to provide you the guidance that was given.
So then at your agencies, was there a memo sent out around what protections workers needing to come to the office had versus field workers?
Was there guidance provided?
Yeah, like was there a memo sent? I know Google, for example.
Yes, we
had sent out a
provided
memo.
guidance to our workforce.
And would you be able to share if there were workers who requested to work from home? Like, was there any kind of
Happy to get you that information.
And then did the city encourage private employers to implement work from home protocols for workers who were able to? Is that also an OLR?
I would, I am not sure about the communication to private employers. I know that there was some conversations, but would have to refer you to City Hall on that one.
Okay. I'm just raising this because I live with an autoimmune disease, and the issue of reducing unnecessary exposure to adverse environmental conditions is naturally very important to me, and particularly through what we've seen during COVID and the sort of revival of the movement to work from home and create different mechanisms to ensure the safety, first and foremost, for our city's workers. And workers, from delivery workers to workers who are running this city, all of our agencies, our staff included. And when the extent of the negative air quality became clear last month, without having any guidance myself, I immediately said, I'm going to be working from home, and I need my staff to work from home too, just to ensure that we are keeping ourselves safe. So I recognize all the ways in which we are sharing out information, but this is a larger conversation about the health of workers for the long haul of this city's well-being and for us to be able to do our work, whether it's outdoors, indoors. And I know some companies are utilizing sensors around air quality monitoring, and those are gonna need to be some technologies that the city needs to research and bring on as we continue to build a more resilient city and adapt to these impacts of climate change. So want us to really focus on ensuring that we are prioritizing workers first and foremost.
Thank you.
Thank you.
I would just like to add that at DEP, and I don't know what the case is with other agencies, we actually did robocalls for our entire workforce, so much so that I started to think it might have been a telemarketer.
For commissioners to have some discretion, because look, different agencies have different, do different things, right? We have different workforces.
Oh, I understand.
And then I think at the same time, we also wanted to make sure commissioners had the ability to take care of the most vulnerable amongst our workforce and make exceptions or be supportive of their needs during this time.
Okay, I mean, I just think, again, looking hindsight in the future, maybe even more specific guidance if we're having an outdoor fire ceremony, if people are working in the streets at DOT, I don't know if they got the information. So yes, you might think that, I just think they need more guidance. I would say that for your debriefing. Councilmember Gutierrez, welcome, and go ahead with your questions.
Thank you so much, chairs, and good to see you all. My questions will be short because I think my colleagues have done a really good job at, I think, elevating what our concerns were on the ground and knowing full and well that this is something that was new and that we needed to remain flexible. I think I'll be honest and say I got my information from the news like everyone else, I think before there was any City Hall press conference. My question is particularly to the impact on already existing environmental justice communities like mine in North Brooklyn, for example. I know in the days after June 6th, which I believe was that was the peak day, June 6th, June 7th?
June 7th.
June 7th, excuse me. So in the days after, I know that the quality index in some areas of the manufacturing area was also very scary. I don't know if it would be classified code red or whatever, but I'm just concerned about what is the plan moving forward for communities that are already impacted by existing poor air quality. In my district, in the South Side, the playgrounds Of course, we wanted to limit outdoor activity, sit on top of the BQE. We have significant manufacturing where people now live and also work. And so the quality index was really, really poor. And I would just like to know, knowing what we've learned since the beginning of June, what is the plan for outreach in existing EJ communities and specifically in these areas like myself and Councilmember Aviles' district where it's highly manufacturing, where the quality just tends to stay poor for a lot longer. What is the plan, specifically in the context of these wildfires that we're expecting to go on for a while, unfortunately?
Well, I'll say first at the health department and our sister agencies that we share your concerns and your interest, and we know that these burdens are not distributed equally throughout the city. And we, as we were, all of our agencies, and including the health department, messaging especially to communities that are disproportionately burdened by air quality and conditions like asthma, we were doing outreach to those communities, and we're going to continue to do that. We've now documented the recommendations that we were making during the event. On our website, we'll be sharing that. We were working with community-based organizations, faith-based organizations at the time, and we will continue with our community outreach to get that information out to those communities so that people can be aware and prepared, because we may continue to experience.
When you say outreach, I'm sorry to interrupt you, I only have a few minutes. When you say outreach though, what is it, emails, flyers, what does that look like?
So we share information with community-based organizations as the trusted messengers in those communities. We have information at our neighborhood action centers, and we have our own community outreach workers who are out speaking with New Yorkers. And we use all of those methods, including also sharing the information with your office and with the office of your colleagues so that you can help us to continue to educate New Yorkers about the steps they can take when the air quality is poor.
And what's the, so I would, and maybe this is more specific for those agencies, but you know, Woodhull has some of the highest admission rates for asthma-related incidents independent from this. So we're just really curious to see kind of how they were able to integrate this like advisory to their community, because they're constantly getting people coming in for respiratory related issues. So would love to hear, or just curious to see how they changed that for this incident. But for similar to what Councilmember Hanif brought up about the private industry, again, my manufacturing area is pretty significant. And again, the air quality just a week and a half ago was terrible in this particular area. So curious if there is a plan, sustained plan for outreach about air quality in this area, or areas where we see that this is like habitually a problem independent from this. I'm really concerned because I don't believe that the private industry is incentivized in the way oftentimes that is responsible for workers, and these are workers that are loading and unloading and really susceptible to bad air quality. So curious if there is a plan in action. I know it's a little tricky because it's private, but would love to know if that is something, a request that I can make, or how we can further that discussion.
Yeah, I think we'd all welcome that conversation. The only other thing I would add to this is, you know, and Corinne spoke about sort of the importance of some of these community-based organizations, but at New York City Emergency Management, we run a program called Strengthening Communities, where we have now close to 50 community-based organizations that we fund and train in emergency response. I would love to invite you in to sort of learn a little bit about the program, but also specifically see if there's any community-based organizations or networks in your district that we should be partnering with. And I think those conversations, those relationships, you know, they know their districts, they know their issues better than we do, and they become such a critical partner to us in addressing some of these things. And so I think that might also be an access point for us addressing
Yeah,
this.
I would love to be a part of that. Thank you.
Yeah.
Thank you, Chair.
Thank you for your questions.
Councilmember Gennaro?
Thank you, Chair Bureau. Yeah, I just wanted to follow up a little bit. This is directed to Commissioner Iskell with regard to the DEC air monitoring. I keep talking about this. You were recently, well, just before you were talking to Councilmember Narcisse, and you framed your answer. You indicated that, within the constraints of the forecast, within the constraints of the forecast. And once upon a time when I came into office many years ago, New York State had a brownfields program, and a pretty robust program, but it really didn't do right by New York City because the main contaminant in New York City brownfields is not one that was it didn't qualify for the state program. So we went way out on a ledge and created like the first municipal brownfields program in the country, which was a lot of yelling and screaming, and it's still, the only one of its kind in the country. My point is that, the city took the initiative to create its own infrastructure, so to speak, to kind of deal with a pressing issue. And, before and yes, I am going to reach out to DEC and ask them about their, capability and could it be more, robust? They don't really have to listen to me. I'm wondering if you think it would be a worthwhile endeavor for the city to consider building its own apparatus in terms of forecasting bad air, for lack of a better way to put it. Do you think that is worthy of internal discussion within the administration to, create that apparatus? If you believe it's necessary, I'll take your guidance on this because you know it better than anybody.
I definitely don't know it better than anybody. I'm not a meteorologist. I've made that caveat before.
Well, I mean,
but look, I think that there's, it's a really good question. And I would want to go and speak to our on-staff meteorologist and some members, from our DEP and others to really talk about whether that would make sense before giving you an answer. But I'm happy to have a conversation with you about it and see if that makes sense.
That would be great. So how should we do this? I'm sort of like an action person.
I can give you my card after the meeting, or I can just have my team reach out and we can schedule something to have a conversation, invite you over.
That'd be,
have DEP there. And
that'd be great. And thank you, Beth. And so if you could, because I'm in touch with Beth all the time. So. Right. If you could, loop us all in on this and make that sort of like a formal request that should be, I don't necessarily want to put my finger on that, I don't want to put my thumb on the scale, but I think it's a worthwhile question to just ask internally or whatever. And maybe there are even, there are other entities, the city could do its own. There are other entities, I'll just pull a name out of the air, like, Columbia University, like, who knows? They got the, Earth Observatory and all that. Whether there is capability that even if we don't build a new one here in the city, that we could sort of triangulate with to see, because I'm hearing a lot about the constraints of the forecast. Now, the constraints of the forecast just could be the constraints of the technology, and for us to build an apparatus, it might not be any better than the one that they have in Albany. It may be not. And so I just think that's something that we I think it's worth a conversation. You seem to believe that. And Beth, if you
could, we're happy to coordinate that. We're certainly looking at ways that we can also monitor.
I'll be waiting for your call. Okay. All right, so thank you very much, and so that was what I had to add, Madam Chair, and with that, my questioning of this good panel is concluded.
Thank you, Council Member Lindstrom. I just want to say one thing about masks, because I did check with staff. Yes, fire stations on Notify NYC, terrific, listed where the masks are, but when we called, Lynn Schulman's just smarter than I am. She called directly herself. But the staff called, and we were told there were no 95s. So just add to your list in the future of debriefing that the mask outreach, when it's called for, if there are or there are not, but we were told there were no 95s, just FYI.
Okay, thank you.
Commissioner Iscol, just to add to your list of responsibilities. I attended an event in January with organized labor about the building of carbon-free schools. And so as we do developments of city buildings and schools and things like that, is there a way to make sure that air quality is built into that, or some kind of method so that the air quality is pure based on what's been happening? So that's my question.
Yeah, I mean, you're speaking specifically about schools?
Schools, any kind of public
Yeah,
entity
I again, and probably not the answer you want, but I would defer you to DOE, but I also know there was a lot of work done to HVAC systems, air purifiers during COVID, to the tune of thousands of installations, but I would defer to them to get you that information. And that was also true of municipal buildings.
Because I think even if, just a suggestion in terms of the protocol, that we need to take a look at the buildings that we have and the ones that are in development, like, for example, City Planning Commission, to say when they look at developments, when they get projects, before they certify them, maybe this is something they should look at as well.
Yep, great.
So the other question I have, I know H&H is not here, so I'm going to ask DOHMH, but I would think that on the day that we had the extreme hazard of air quality, when people are being discharged from the hospital, would they get special instructions when they leave and get N95 masks? That's my question.
I will defer to H&H, but I'll say again that we did issue guidance for healthcare providers,
Okay.
so that they would be able to counsel their patients.
Okay. Thank you very much. Those were my, I'm sorry, one other, Commissioner Iscol. So one of the things that was confusing during this whole process was that the governor's office very often would have a press conference, and we'd get notified as elected officials the same time the mayor or somebody on the city level was having it. So is there coordination with them around this, and should there be better coordination?
With the governor's office in particular, yes. And I was, throughout these events, I'm in constant communication with Jackie Bray, my counterpart.
Because I was notified about a press conference at the same time. The city was having a press conference, and it was hard, like, who's going to be where and where are we going and all that. So I just wanted.
And I don't want to sound like a broken record here, but part of this is like, I think sometimes these press conferences are called, you've heard it here before, because of the constraints of the forecast, right when the air monitors are hitting something, and so there is a time to target of having to be very quick. But I do hear you. Yeah.
We just want to have one coordinated message, I guess, is what I'm saying.
I would love that.
All right, thank you very much.
Thank you, Councilmember.
I think that the Committee on Oversight and Investigations asks for a lot of this guidance. I think we sent a letter on June 21st, and I know you answered some portion of it, but there were documents related to some of the adjustments of city operations and, things that we've mentioned, June 5th to 11th, whatever directives were issued from City Hall and from the mayor's office to city agencies, trying to clarify what we've been asking about which agency was doing what. And also, I think included in there was guidance for shelters. I know you mentioned it and then you did it. Are you going to be able to put that in writing as to what did take place in terms of those edicts, so to speak? Would that be something
you
you
speaking
could answer?
Specifically for DSS?
I'm talking specifically from the mayor's office. In other words, all of the edicts that would have gone out between June 5th to the 11th regarding this issue. And then in addition, there was a request for guidance, what went out to the shelters or whatever DSS.
So I can't speak for the other agencies. I definitely can't speak for the mayor's office.
Okay.
I can pass along your request and would be happy to do that. Okay. And I would just want to caveat that with again, sound like a broken record, talking about sound like a broken record. We didn't have a forecast on the 5th or the 6th telling us that there was going to be a problem. So, right, we were amplifying the advisory, which is what we do up to dozens of times a year when we have a level of 100, which is, really fine for almost every New Yorker, right? It's unhealthy for some groups. It's in the just above the moderate category. So you're not going to see a lot on the 5th or the 6th because we didn't have a forecast of that. Okay. The 7th was the first day where we said, okay, now we have hazardous air. Now we are starting to do a lot of this stuff that you're talking about because that was the day that we actually knew we had hazardous air and knew we were going to have hazardous air.
So according to our material, the night of the 6th, it reached 218. Is that
218, there's one sensor in the Bronx that showed 218 in the Bronx, and that is when we immediately started a lot of this coordination that we've been talking about.
Okay, and then it went to 254, and then finally, as we know,
484.
484, yeah. So
Correct.
those were the, right, but I'm just saying, so in order to get this information, you're telling us we have to write to the mayor's office and we have to write to DSS. It's always my impression that in these extreme emergencies, your agency, this is from my many years, really becomes the mayor's office in a sense of being in control and would in fact have all of this information, maybe not today, but would be able to get back to us. Is that not correct?
That is not correct.
Okay, so it's all the different agencies are on their own in giving us information?
We are closely coordinating and managing, but, you know, they are actually doing they are doing the work. And the mayor's office is still running the show.
Okay,
And
so in order to get the information as to what they sent out to parks or to fire or whatever,
Right.
we would have to call them or contact them
Or go directly to the mayor's office and
and ask them to tell us what the agency sent out.
yeah.
Right, that's not what I understand how city government works, but I appreciate that. Are there any other questions?
And I will try and help you get that information as well.
No, I understand. It just seems to me that you should be in charge when there's an emergency, and the mayor's office should defer to you in getting the information to the public. Maybe we need a new law. I'm just saying. All right. Any other questions? Thank you very much, if not. Thank you,
Thank you. It's
panel,
good to
very
see you,
much.
Chair Bernard.
The next panel is?
Are we going to take a 5-minute break?
No.
Thank you very much for your testimony. We will now turn to public testimony. We will be limiting public testimony today to 3 minutes each. For in-person panelists, please come up to the table once your name has been called. For virtual panelists, once your name is called, a member of our staff will unmute you, and the Sergeant at Arms will set the timer and give you the go-ahead to begin. Please wait for the Sergeant to announce that you may begin before delivering your testimony. And I will announce the first panel momentarily. All right. For our first in-person panel, we will hear from Jared Williamson, Joel Kopferman, Michael O'Hara, and Joy Amanda.
Okay.
Did you sign to speak?
Please note that if you are here to testify in person, even if you registered to testify online, please see the sergeant's table to complete a witness slip. Thank you.
All right, whomever would like to begin, go ahead.
Good afternoon, everybody. My name is Jared Williamson. I am a legal intern from the Environmental Justice Initiative. I want to thank you for taking the time to hear my testimony today. I am here to talk about the need for an increase and improvement in cooling centers in the city of New York. We at the Environmental Justice Initiative are particularly concerned about access for these resources for people with disabilities, especially when seeking refuge from the Canadian fire smoke incident, as well as other similar environmental dangers. In accordance with the Americans with Disabilities Act, individuals with physical or mental impairments that substantially limits one or more major life activities, discrimination for access to resources is strictly prohibited by that law. And one of the things that we are concerned about is that in 2022, 22% of cooling center facilities were not wheelchair accessible. We strongly urge the City of New York to take the necessary steps to ensure that these cooling centers are handicap accessible. Additionally, we strongly recommend that resources or supplies such as air conditioners and air purifiers are regularly updated in these cooling centers for individuals with asthma. We want to ensure cooling centers and clean, safe air centers in the city of New York are a very valuable resource, and we want to ensure that people with disabilities have equitable access to these facilities. And I will yield the rest of my time. Thank you so much for taking the time to listen today.
Thank you. Next speaker.
Good afternoon. My name is Michael O'Hora. I'm a law student at the Elizabeth Haub School of Law at Pace University, and I'm interning at the Environmental Justice Initiative with Mr. Joel Kupferman. This summer, New York City was inundated with smoke from wildfires in Quebec, Canada. The air quality was incredibly unhealthy during the period in early June, with an all-time record being set at 413 on the AQI scale on Wednesday, June the 7th, a level considered hazardous and a health warning of emergency conditions, according to airnow.gov. The city's response left much to be desired. I would like to focus on the existing air quality problems in New York City that were exacerbated by the city's non-response to this crisis. When proper precautions are not taken at construction sites, air quality can be worsened by the use of fossil fuel burning equipment and, more importantly, the disturbance of contaminated soil that introduces contaminants such as arsenic and lead into the air. During the air quality emergency in June, the city should have suspended construction activities to limit air quality from degrading further, but this did not happen. In the limited time I have, I would like to focus on one remediation site in particular at the NYC Jacob Riis houses located between Avenues D and Franklin D. Roosevelt Drive, spanning 2 super blocks from 6th Street to 13th Street. Construction activity at the site have disturbed the soil and caused it to become airborne, thus resuspending harmful compounds from the soil into the air that then enters resident apartments. We know that the soil contains alarmingly high levels of arsenic, lead, and other heavy metals, and so too does NYCHA and the City of New York, as the city was tested in 2007 for Con Edison. While the report may be dated, arsenic, lead, and other similar harmful contaminants are just simply elements on the periodic table, meaning that they do not degrade over time or break down into something else. Arsenic will always be arsenic, and lead will always be lead. New York City has the jurisdiction to stop construction at NYCHA developments. During a crisis such as this, NYCHA cannot be the sole agency responsible for Riis residents and all other residents, as it has failed the residents in the past. As we know, all NYCHA developments are currently under federal monitorship due to the situation with lead abatement in resident apartments. And the solutions to this problem are not exceedingly complex. During this smoke emergency, the city should have suspended all construction activities and offered masks and other air filtering equipment, especially to its most vulnerable residents, some of which live in public housing. Even without the wildfire smoke, precautions could have been taken, such as covering the soil when work is being done and covering windows and AC units for residences on lower floors facing construction activity, and providing air filtration equipment for apartments closest to the construction activity. In short, New York City failed to protect its residents. In a recent Times article, Mayor Adams dismissed concerns from reporters that the city should have had a plan in place for the smoke. Professor Rebecca Bradsby from CUNY Law was quoted in the same article saying that the masks were distributed too late and that she herself had been monitoring the smoke since at least the previous week, so the city should have had some indication that such an emergency was going to happen. The City of New York must do better going forwards. Vulnerable populations are in these public housing developments, many of them with pre-existing health conditions due to 9/11. They need to be protected along with all New Yorkers. Thank you.
Thank you. Next.
Thank you very much. Joel Kupferman, Executive Director and Senior Attorney of the New York Environmental Law Initiative. I represent many community groups and workers after the 9/11 attack when nearby residents were told that the air quality was safe. And I think it's important to point out that it was DEC's reports, initial reports, that told us the air was safe, and they depended on their monitors. So I think it's really incumbent upon us not to just blame DEC, but not to just totally rely on DEC's warning system. It's brought up over and over again that this situation now is unprecedented. It's not. We have 9/11 to look at. We also have what happened with the COVID. I, as Michael pointed out, represent NYCHA residents where there's a lot of construction that's going on, where the soil's not covered. Why that's important is that it's the additive cumulative effect of the dust from Canada and with the local dust that's generated. New York City can control that dust by just enforcing the law and the regulations. I represent Esther Ragelson, who lives at 109 Washington Street, a 9/11 survivor with cancer. There's a brownfield site there. Construction continued on the worst day on the 7th. DEP, New York City, sent an inspector in to check the site based on our complaint, and we were told that they were just issued a violation because of visual dust. But that DEP inspector wasn't even aware that this was a brownfield site. So we have a major communications problem. The city is also liable that it's sending its old employees in to toxic sites during the worst times. Esther, on 7th, had a reading of 569 based on this monitor that's only $300, okay? The city health department and the state refused to monitor indoor air. We heard today that that's the center where all most of the problems are. They're also denying that that dust is going into people's air. The city Department of Health has a mandate and the equipment and the ability to monitor that air. I urge that City Council look into DOH's responsibility, and also that I take real affront that we kept on talking about sensitive populations. New York City, in terms of the EJ community and the elderly, have the highest rate of sensitive things. So we have a lot of problems in terms of equal protection, and also we believe that we're asking that. Okay, could I just finish?
Yeah, go ahead and finish quickly. Thank you.
Okay. We're asking. California was mentioned. We're going to present a copy of the California air law. There's a lot that could be borrowed for. They have much better control over construction sites in terms of reporting and enforcement. We want to increase injunctive relief to DEP and DOH. DEP told us when they spotted that air, they have no control over stopping that construction. When we met shortly after with the Department of Buildings, DOB was never informed by DEP that there was air problems there. So we have a major problem with interaction.
You need to wrap up.
Okay.
Because we have your testimony and we will certainly read it.
Okay. But I think it's important for the city not to just blame the state, that there's a lot of enforcement abilities, and that especially we're concerned about ongoing construction at brownfield sites, and also that city workers have a right for an ombudsman.
Absolutely. Thank you very much. Next.
Just press the button, right?
There we go. My name is Joy from Queens, New York. Been in New York for almost 40 years. Birthday was actually this weekend. And I'm pretty disappointed with City Council right now, because I came in and the room was pretty full with my employees and now my employees are gone. And as someone who has employed city council, who is supposed to hear exactly what the people feel, exactly the opinions of whoever comes in and they want to give a statement to their employees, because we are the ones that are in charge, it's disappointing to see how many has left, especially the ones that are on the Committee of Health. 2 of your members that are not here are actually on the Committee of Health, and they're gone. A lot of them are gone. It honestly should be, and from what I heard, there's 51 city council members, they should all be here. Every last one of them, only for the simple fact that they all take an oath to office, they all take an oath to the Constitution, to the state constitution, and to the city charter. And it directly tells them what their job is. And their job is to do the will of the people. And they're not doing the will of the people. You take an oath. Everyone takes an oath. You take this job, you take an oath. 5 USC 3331 says that you take an oath. You are supposed to uphold the will of the people, the rights of the people, defend and protect them, and no one is here to listen to the people.
Well, we're here. There's some of us here. We're here listening.
But you know that's not enough. For the 8.4 million people that live in New York City, just the 6 of you in here, and it's actually 3 of you because you have committee council, it's not enough, and it's disappointing. But the question is, and if I could get a response, do you take an oath?
Yeah, we all take an oath. Yeah.
Have you submitted your oath?
Submitted oath, yes, we have.
Is it on file?
Yes.
Where can I find it?
Board of Elections, City Clerk.
Okay, do you take that oath serious?
We do, but.
Do you know that if you violate that oath, that violations can be brought up on you?
Yeah, can I just say, feel free to keep during your time period. We'd love to hear your opinions also on the issue at hand today, on the air quality. We'd love to.
Well, I had to make that the foundation of whatever my discussion will be with you all, because again, as the employer, I am disappointed. And when an employer is disappointed with any job that you have, they're going to reprimand you and they're going to tell you where you're wrong. And this is where City Council is wrong. City Council says that they're going to do the will of the people and they're going to speak on their behalf. They're going to pass these ordinances, make policies and regulations, but then they're not here to listen to what the people have to say about that.
I just want to be clear, some people have other meetings. The people who brought the meeting, chairing the meeting, are here. We're taking everybody's information very seriously, just so you know.
It's still disappointing. So that needs to be on the record.
That's fine.
That the employer, the boss, is disappointed with the employees.
Okay, but now your time is up.
Well, I'm going to continue speaking because it needs to be understood that City Council only has one job to do.
Okay.
And it's to uphold the will of the people, to uphold the rights of the people.
Okay.
You want to talk about the air, you want to talk about air quality, you want to talk about public health, you want to talk about regulations, what can be passed, what can be put in place, but no one is doing the will of the people or the rights of the people and upholding it.
Believe me,
you have no authority.
Okay, we are here making sure that laws get passed and we're listening carefully to make changes. That's why we're here.
And the laws would be for who?
The oversight hearing is to talk about air quality.
And who are these laws for?
If you want to make some statements on that, fine. Otherwise, your time is up.
Who are those laws for?
The people of the city of New York.
Who are the people of the city of New York?
Ma'am, I can't go through this. There are other people who want to testify about air, okay?
And you're going to be asked the same questions.
Thank you very much.
We'll see you in court.
Thank you very much for your testimony. The next panel.
Thank you for your testimony. We'll next hear from Eunice Coe, Janet Handel, Daniel Lin, and Domina de Brenda Black. To announce the second panel once more, Eunice Coe, Janet Handel, Daniel Lin, and Domina de Brenda Black. Eunice Coe, you may begin when ready.
Great. Good morning, Chairs Gennaro, Schulman, and Brewer, members of the council. My name is Eunice Coe. I'm the Deputy Director at the New York City Environmental Justice Alliance. Founded in 1991, NYC is a nonprofit citywide membership network linking 13 grassroots organizations from low-income neighborhoods and communities of color all across the 5 boroughs in their struggle for environmental justice. Last month, the city was overwhelmed with orange skies, red moons, and choking smoke from the raging Canadian wildfires. The city literally gasped for breath as it turned gray, orange, and then red. "What the hell is this?" asked the mayor a little too late as he stepped outside. By the time the mayor had issued a statement late on Tuesday night, people were already getting headaches and chest pains, coughing, and are having trouble breathing. Neighbors, kids, families, and friends were scared and confused as we asked ourselves, fan or AC? How bad is it to leave a window open? What will this do to my health? One of our members who has a son with asthma and is the head of a nonprofit CBO in the South Bronx didn't know what was going on and what to tell her son when asked. But EM reaches out to CBOs and is doing everything they can on that front, right? New York City residents were left again on their own, and of course those most vulnerable, like the unhoused delivery workers and those with asthma and other health conditions, suffer the most consequences. Asthma-related emergency visits spiked during this time, and many areas in the city, like the Bronx, reach AQI levels higher than 400. According to the Public Advocate's report, between June 6th and June 7th, the hospitalization rate in New York City jumped 81% to 317 ER visits on June 7th. Unsurprisingly, the New York City zip codes with the highest numbers of asthma-related emergency room visits during last month's smoke haze were disproportionately in low-income, predominantly Black and Latino communities, according to Gothamist analysis. According to EM Commissioner Zach Iskall today, though, these hospitalization rates are fine, as he repeatedly said today. I guess when we're talking about Black and brown communities, it's completely acceptable. This flies in direct contradiction to when he stated that EM, quote unquote, did everything to help vulnerable New Yorkers. Despite how unhealthy and hazardous conditions were, the administration didn't act swiftly and aggressively enough to alert the public and protect the most vulnerable. The administration failed to minimize the effects of the wildfire smoke by not providing timely notice and sufficient information, and failed to lead a strong interagency coordinated response. While the event on this scale was unprecedented, the administration could and should have done a lot more for a public health emergency at this scale, especially since as recently as 2 years ago, New York City's skies also turned hazy on July 13, 2021 from California wildfires, with our local air pollution levels spiking to unhealthy levels of over 100 AQI. So this is not the first time this has happened in this city. Commissioner Iskall kept talking about the forecasting constraints, but there is air quality data information that's available in real time. While these may not be projections, there is a ton of information and resources available. Before Commissioner Iskall said he had any information from the state. EPA updates federal monitors daily, and I was getting that information alerts from Google Maps alerts. Sorry, I'm almost done. The city could have canceled outdoor events, activities sooner, instituted a clearly communicated policy where all shelters would have to take in anyone in house seeking shelter, encourage other energy-saving, emission-saving activities like minimizing car use, household appliances, etc. The reality is that some communities in New York City experience bad air quality and pollution today. And these communities, again, are being burdened by wildfire events as such as today. We must anticipate, sorry, I'm almost done. We must anticipate and prepare for the unforeseen in order to keep our city safe and healthy. The city can't put New Yorkers in a position to respond and adapt to climate change completely on their own, whether it be from wildfires, flooding, or extreme heat, because it will mean our communities will suffer the most. If the administration's posture is to be defensive, deflect, and give polished non-answers and say we are doing everything we can, then we are in trouble because things are getting worse. We may not be perfect, as the EM commissioner dismissively stated today, but we can be better.
Okay.
And I didn't hear that acknowledgement or responsibility from the administration today. Difficult to do is not an acceptable answer when climate change is increasing and people are dying.
Thank you very much. Next.
Is it on? Good afternoon. My name is Janet Handel, and I'm here wearing, I guess, actually 3 hats. I'm president of the Waterside Tenants Association and represent the 4,000 people living at Waterside. I'm also the president and co-founder of TRAPAG, that's Transplant Recipients and Immunocompromised Patient Advocacy Group. You see that I came today wearing a mask almost the entire time. I'm speaking without a mask now because I have a sterilization device that gives me like a cone of safe air. I'm also a member of the National Advisory Committee of Johns Hopkins Global Health Security Initiative on air quality. Vulnerable populations depend on you, the mayor, and the city agencies to keep us safe. In New York City, there are about 275,000 immunocompromised. We ask you to step up your engagement on air quality, both outdoor and indoor. First, I think you should raise public awareness on air quality, both indoor and outdoor, on what PM 2.5 is, why people should care about it, what CO2 is, and why you should pay attention to that when you're indoors. I would suggest that there be ongoing posting in the subway, on Link NYC, on city websites, so people are seeing this everywhere they go, 2.5. And what is that? Why do I need to know about that? What does that mean? Why it's better to have a good quality mask rather than a surgical mask? They need to understand that. If you give people the information, they will take appropriate action. Implement a public education program, raise the risk of 2.5 and other pollutants, so people understand why they should wear high-quality masks. Disseminate information on how to make do-it-yourself indoor air purification devices. They can be made very cheaply for about $30 and provide a level of safety in the home. Direct building owners to close air takes on passive airflow systems. I didn't hear anything about this today. In our building, there are fans on the roof that blow air into every floor. Fortunately, our building shut them down, but there was no citywide mandate if you have, buildings, so all these places that are supposedly safe indoors, when they're blowing all that air indoors, is it really safe? Should you mandate that they upgrade their filtration system on these air intakes? Because this is going to be happening again and again and again. Our buildings are 50 years old, so I'm sure they don't have robust air filtration. I also think it's important to modify multifamily buildings to have one switch shutdown, so that if in an event of a bioterrorism event, in our building they had to go to like 4 buildings, 8 floors to shut down all the fans. They did it, but that's not fast enough in certain circumstances. I encourage you to set guidelines for indoor air quality for CO2, PM 2.5, and ozone, and require public spaces to post visible monitors like this one I have right here. In Belgium, they are requiring this in any public space that there be monitors so people know. CO2 is a proxy for the amount of aerosols that are in the air, so in a time when COVID is very high and the CO2 level is very high, that's a dangerous place to be. I would also suggest that you suspend outdoor work and activity when levels go above a certain level. I saw construction workers working when the cloud was at its worst. So how did that happen? That should be suspended. And then identify distribution stations which will be used again and again, so that it just gets ingrained in people's minds. When we have an air quality event or we have a COVID event and I need a mask, I know these are the 5 places I can look for a mask: the library, the fire station, the school, So that's it. Thank you very much. I appreciate it.
Thank you. Next.
Hi, I'm just a concerned free man living in Queens, New York, and we've heard all the talk about what we brought to respond to air quality. My question is, for my employees, what legislation is being proposed for air quality? Who writes this legislation, for the record?
The legislation is drafted by the City Council drafting legislative staff.
Is that by the corporate council?
No, City Council staff, and then Corp Council and others look at it. It's a long process.
Okay. Well, you said corporate council. That's all I need for the record. Thank you.
I also want to let you know that there are a number of bills that are being introduced on air quality that I'm co-prime sponsor on. That's being done by Councilmember Keith Powers and Borough President Mark Levine.
And that's good for the record, too, because that was my next question: who are the co-sponsors? Just as a reminder, stating Marbury v. Madison, all laws, rules, and practices which are repugnant to the Constitution are null and void. So any legislation that's proposed by corporate counsel or co-sponsored by whichever of my employees want to co-sponsor it, if it violates my rights as a free man, it's null and void. It can't be enforced. And also citing Hostin v. Linham, there can be no limitation on the power of the people of the United States of America. By their authority, the state constitutions were made. By their authority, the Constitution for the United States. Because as was mentioned, my employees take a public oath to uphold the United States Constitution, the New York State Constitution, and the New York State Charter. So if my rights are violated, any legislation is null and void. It can't be enforced. You can submit any recommendations, suggestions, anything like that, but at the end of the day, it's my decision as a free man living in New York to make that decision for myself, how I protect myself and all the other of your employers who employ you to uphold your oath. It's their right as free men and women to make that choice for themselves. And just to make it clear again, it's very disappointing how nearly every one of my employees has left this meeting. Everyone should be here to listen to the will of the people, and that clearly is not being done, not just when it pertains to air quality, but when it pertains to other matters as well. Thank you.
Thank you. Next.
Hello. Hi, good afternoon or good morning. I'm known professionally as DJ Black, but you may call me Domina. I'm here to speak on behalf of myself as an individual woman living on the land of New York. I would like to say, though, that I do volunteer with several groups, including but not limited to Log Cabin Republicans New York, the Conservative Republican Alliance. I also am the co-founder of the Lex and Third Block Association and the founder of TFK-TWA, Training Foster Kids to Work with Animals, a nonprofit academic program. Our dual mission is to prepare foster kids for adulthood and help animals at the same time. All my opinions, though I associate with those groups and views, are my own and do not necessarily reflect the views of those groups. I would like to make a brief statement and then I have a question. My statement is that I was listening today and I was hearing a lot of appeal to authority arguments, and if we look at history, these same agencies are the agencies that said it was okay to operate on infants without anesthesia because they said babies wouldn't remember and wouldn't feel pain. That was happening till the 1980s. Some of these organizations that the appeal to authority that is being used to make these decisions are the same authorities that sterilized Puerto Rican women from the 1930s up into the 1980s, saying that it was for the public health. I would also mention the Tuskegee experiments, I may be saying that wrong, where black men were given syphilis so that the doctors could see the effects of it. This was done in the name of public health. So I get very concerned when things are brought forth about things for the public health, especially as a woman from the gay community and a woman who is Latino. We often are the ones who get experimented on, and it concerns me greatly that the decisions that are being made are so shaky. Even today, there was arguments back and forth between who's telling the truth, who has the facts. There's no substantial way to tell the air quality. And also, I would like to say, could the person who is from the Public Advocate's office please raise their hand? Okay, when the public advocate left, I asked him, I said, is somebody gonna be here for the public when we speak? You're our advocate. He said, someone will be here. There's no one here. I would like to echo the sentiment of earlier citizens that it is not right that you leave, not you, but that your peers and the people that we elect our public servants to serve us leave. Like, how do you know the will of the people if you don't listen? And I'd also like to say, as far as climate change, I'm 54 years old. Since I was 5 years old, I was told that the sky was gonna fall regarding the weather. In the 70s, I was told the world was gonna end in 2000.
You need to wrap up.
I think that my point is made in that, and I would also just like to say, in wrapping up, please remember the Puerto Rican women who were sterilized in the name of public health. Please don't make the same mistake. I bless you all, God bless you. I think you have good intentions. And also, I would just like to say, where can I find your oaths of office? Because I never heard of that before, and I would like to read them. Can you tell me where I can find them?
They're all the same, and they're at the city clerk's office.
So every single councilman?
All the same.
And does the public advocate take the same one?
Yes, he does. But can I say, there's a lot more people who want to testify.
Okay, I just wanted to add, that was it. That was my last question. I just wanted to ask where I could find those oaths.
Thank you very much. Thank you all very much.
Thank you, God bless you.
Thank you for your testimony. We will now turn to our final in-person panel, and we will hear from Morgarile Chandler, Donna Gianelle Romo, Eric Rossi, Shanae, Tana, and Miles Aiken. If you're here to testify in person and you have yet to hear your name called, remember, please go to the sergeant's table to fill out a witness slip. Thank you. Once more, the final in-person panel will consist of Morgarile Chandler, Donna Janelle Romo, Eric Rossi, Shanae, Tana, and Miles Aiken.
Whomever would like to start, go ahead. Thank you. You could go ahead. Go ahead.
Good afternoon. My name is Tana from Brooklyn. And I want to start off by also sharing the same concern as to half of this panel being non-existent, for the record. First question is, what is your definition of public?
Okay, this is usually you testifying, so go ahead and talk about air quality, and then we can ask if you...
Based upon the answer is how I will proceed.
Public is the public speaking, and the elected officials listening, and the public being listened to. I'm here to listen to. I'm an elected official. We're here listening very carefully, and there are also people listening online.
Fantastic.
But I would like to hear what you have to say about the air quality.
So on the record, that's your definition of public. So now what's your definition of public health?
Well, can you testify? That's what I want to hear. If you have something to say, that would be great. I really want to hear what you have to say. That's what I need.
As men and women of the land of New York, when we come to these hearings and we share what we have to share, and tell us what we're going to say is not going to work, okay? You guys take an oath to the Constitution to adhere to the men and women of who you serve. So again, what is your definition to public health?
Public health to me means we want to keep New Yorkers healthy. And your testimony...
You want to keep
all of us
New Yorkers healthy.
I do. But I really want to say there are a lot of people who want to testify about public air health. If you'd like to make your comments, they would be much appreciated.
So the reason I ask is because when you implement any of these policies or laws or bills, we want to know who exactly that is addressed to. And when you look at the term, say, for example, person, you say a lot in your paperwork, in your verbiage. A lot of that has the term person and public health, and so forth. So with that being said, the definition of a person will let me know whether or not what you're proposing holds any authority over the men and women of NYC. So a person, according to reference 15 USC Section 7, 26 USC Section 7, I am wrapping it up.
You need to wrap up. Thank you.
Defines person as an officer or employee of the corporation. Therefore, these policies that you're looking to implement apply to you. And with that, I yield back. Thank you.
Thank you very much. Thank you. Go ahead, next person.
Hi, my name is it on? No. Hi, can you hear me now? Okay, my name is Marguerite Chandler, and I live in Brooklyn, and I'm a member of the Medical Freedom Party. We have 20 people running this November for City Council. One of the major issues we have is with the lockdown and with the mandated injections. It's come out that this so-called science that everybody claims was real science didn't actually protect anybody, didn't actually protect us. And actually people died as a result, and businesses were lost that aren't coming back. So we're very concerned that this issue about air quality will turn into another mandated lockdown, everybody wear masks, and what other kind of it's dictatorial It's basically a mandate is a dictation or an edict from the Roman times by the Caesar, by the king. We gave that up. That's why we're Americans. That's our identity. Our identity is the Bill of Rights, okay? That's what gives us our identity as Americans. That's the only identity we have, because all of us come from different places. That's what we are proud of. And we can't have officers of the court or judges or governors telling us that we no longer have a right over our own body to decide whether we want to have an injection, a mask, whether we have to close down our business. We need to have our Bill of Rights. That's number one. And it is true when people bring up the oath of office, when you take an oath of office, you're take an oath to defend that Constitution, and that hasn't been done. Now, I know that I don't have time. I'm going to write up everything I want to say, and I'm going to publish it, and I'm going to send it to you guys so you'll know the full story in the context of what I'm talking about.
Thank you very much. I appreciate it. Next.
Hi, my name is Donna.
Push the button. Push the button.
I guess that would help, wouldn't it? Hi, my name is Donna, and I am in agreement that I am not happy as far as the fact of what is being done already as far as these laws or policies and the fact that people aren't here. I would like to present something that furthers the negative impact of the air quality pollution and those affected, those with asthma, those with problems with their respiratory, as well as tinnitus and everything like that. And that is wireless devices, antenna networks, and data centers are consuming an ever-increasing portion of the global energy supply based largely on coal. Our energy calculation, this is by reinventing the wires. Now here we have something from the Center for Energy Efficient Telecommunications. Wireless access networks are clearly the biggest and most inefficient consumer of energy in the cloud environment. 5G is considered an energy hog. And you guys are talking about wanting to get to the 0 point, and yet you have this kind of industrial pollution that only impacts that and furthers a negative impact of everything that's already going on. You have an increase by 2015, this is older. Wireless cloud will consume up to 43 TWh compared to only 9.2 TWh in 2012, an increase of 460%. Hello? This is an increase in carbon footprint. And this goes from 30 megatons of CO2 in 2015, the equivalent of adding 5.9 million cars to the roads. And we're trying to keep out the cars, right? Is this start and everything that's going on now, are we trying to get more towards that 15-minute city, as they call it? So this has been just totally ignored. I, as a therapist, I know personally of people who have to live in their bathroom because it's shielded, sleep in a parked car in a garage because there's a shielding, and also you may know of Maria, who was from New York City, who committed suicide because of the suffering and isolation, which has been completely ignored by any of the organizations here in New York City as far as how much they suffer. So I am bringing that to as far as nothing is being done, and we are just, there's always solutions for fast, safe, and secure internet connections. So that is what I am bringing to all of this as far as air quality, as far as what seniors, people with asthma, tinnitus, if you want to call it, and all sorts of other things. Thank you.
Thank you very much. Next.
Hello. I'm Eric Rossi from East 10th Street in Lower Manhattan. Now, when the commissioner was speaking, as he said, this is an absolutely unprecedented event occurring at the beginning of June with that gigantic cloud of smoke, which we've never seen before in New York City. And how did that happen? How could such a massive cloud emerge out of Canada. That's never come before. It's never happened before, as I said. So there's only one way that can happen. 14 separate fires, all erupting simultaneously. All erupting simultaneously in southern Quebec, hundreds of miles apart. If one fire erupts and 3 hours later another fire erupts 100 miles away, or 4 hours later another, the wind change will take the smoke in various directions. In order to produce a gigantic cloud of smoke like that, you have to have all fires occurring at the same time, so that the smoke cloud concentrates and develops, and then carries forth in the same direction, the same concentration. That's what actually occurred at 9:30 a.m. on the morning of June 2nd. Now, how do we know that? There's a college in Illinois called the College of DuPage, which monitors and aggregates information from the weather satellites that are above the continent of the United States. Now, that college put out a video of the monitoring of what was occurring in southern Quebec at that time, and 14 separate fires all erupted simultaneously, and they're many miles apart. It's not like one fire led to another. It all happened at once. Now, there are some arson investigations going on in Canada over various fires, but as far as I know, nothing is happening with that investigation. You're the committee that can do something about that. This was an attack on this city. That massive cloud of smoke didn't happen in a natural way. So I'm urging this committee to look at the information that we'll provide to the Department of Emergency Management and also to you yourselves, to take a look at how these fires could possibly erupt simultaneously.
Thank you very much. That's very helpful. Thank you. Next.
Thank you. Let me make sure. Can you hear me? Yeah, I can hear myself, so I'm assuming you can hear me. My name is Miles, M-I-L-E-S, Aiken, A-I-K-E-N. And I'm from Harlem, and I'm from the #1 sports youth saving program in the world, which is called the Rucker Park. That's not because I call it that. That's because it's recognized as such. The first thing I want to say...
That's Bob's Park, right? That's Bob's.
So did someone say something?
I did. It's Gail Brewer. That's Bob's Park. We call it Bob's Park.
I'm sorry, what is...
Go ahead. Never mind, sir. Go ahead.
Bob's Park?
Oh, Bob's Park. That's Bob McCullough, who we call the commish. Well, he calls himself the commish.
Yeah, go ahead, sir. Sorry. I just
but anyway, the first thing I want to express, because I know you've been here a while, and we just got here, is that I want to thank Congresswoman Brewer for, she's well documented, and I know personally that she's one of the most significant, open, caring politicians of this city. And through that, we have the chance to hear all of the contributions. And I'm not a paid political activist, okay? So I want to make sure that I'm clear, for me, as a representative of Harlem, a low-income community that is documented now globally, low-income communities suffering in these types of disasters, okay? The second thing I've asked to come and testify is because on my cell phone, I have documented that I spotted the initial ignition of the fires in Alberta, Canada. Alberta, Canada is the seat of the Canadian fossil fuel industries, which is still like the fossil fuel industries